At the International Day of our Congress, we had a very distinguished guest by our side, Mr. Joseph Mikhael, and he's professor from U.S. City of Hope Cancer Center. Am I right?
Yes, you are. Thank you.
He's also the executive member of ASH. Welcome, sir.
Thank you very much. It's an absolute privilege to be here.
First of all, at the first time of Turkish Society of Hematology, you had a joint meeting between ASH and Turkish Society of Hematology. Could you give a brief information about this meeting?
Yeah, it's wonderful for us to be able to share this symposium together. You know, ASH really is the American Society of Hematology, but we know it represents people from all over the world, and we really have had a greater international focus over the last several years. And so being able to partner with the Turkish Society this way and have me come and share a lecture and collaborate together, we think is very important. I think it speaks to the importance of greater international collaboration and potentially, even with time, the ability to have more meetings in this region.
Yeah. And could you give some information about your lecture during this session?
So I was actually asked to address what I think is a fascinating topic. I'm a myeloma doctor myself, so it was of course about myeloma, but we wanted to combine the science and the clinical aspects of what we sometimes call clonal evolution or multiple clones in myeloma. So the essence of my lecture was that multiple myeloma is really not one disease, it's actually multiple diseases together, that many of our patients, not all, but many of our patients have more than one tumor within their same myeloma. And we sometimes call those subclones or clones. And we've done a lot of work at our institution, and I've had the privilege of being a part of a lot of work to understand these clones and what they mean for how we treat people. And it's influenced the way we've treated myeloma over time to ensure that we use combination treatments and that we look carefully to see if there's been a disease biology change in the patient, which influences, of course, their prognosis and influences the way we treat them. So it was really a privilege to be able to speak today from both a scientific and a clinical side of something that is very research-oriented, but also something very patient-oriented.
I want to go back to the collaboration between ASH and Turkish Society of Hematology. How does this collaboration affect researchers, and are there any future projects between ASH and Turkish Society of Hematology?
Yeah, that's a fantastic question and a very important one. You know, one of the things that ASH loves to do is to try and enhance and foster collaborations around the world. You know, individual centers do great research, but as being a researcher, I know I can't function by myself. I need to collaborate and connect with others. And the annual meeting that ASH holds every December is really a touch point for so much of that collaboration. That being said, we know that a lot of people either can't come to that meeting or are just not able to make it to the meeting. And so we've tried to partner in different ways with different organizations around the world to hold joint symposiums like this one, to help researchers go back and forth. We have a visiting professor program and visiting training programs so that different individuals can go to different places to understand things better and bring that expertise back to their center. And then looking ahead with our partnership with the Turkish Society, we obviously start with a symposium like this, but the full anticipation is that with time, we can have even more opportunities to collaborate together, possibly to host meetings here or to share meetings together in the region. Now, Turkey is a huge country with over 80 million people with a very strong hematology presence in the world. And I think it would be exciting for us to be able to work together more to help the patients of Turkey and the region and encourage the research that we know is so fundamental in hematology.
Thank you so much being with us here today at Congress TV broadcast.
It's an absolute pleasure. Thank you for having me.